This is day 3 of the New York City coronavirus tour of duty. Yesterday, God, I felt so inspired and good, and felt like it really made a difference helping a patient and her daughter at the end of life to get the daughter in to spend some time and say goodbyes, and also shared that victory of a young person who had survived and was discharged, and how different how things can swing and change in a day. Today was hard and overwhelming and messy. We got started today, and the first 4 or 5 patients that we rounded on, they're all dying. We were actively treating them. They had gotten all the medications, and we're doing our best to manage them and give them the right amount of oxygen and fluids and on and on. But it's just not even close. Like, they're dying. And I have done this long enough where it really doesn't serve the patient, the family, or anybody to be in denial of that reality. People can still want to be treated until the end and have everything done, and we can do that. But I think there's these. I think it's easy as a doctor to kind of get caught up and to always want people to live and to be victorious. And we cure disease. That's what we do. And God, it feels good to treat somebody with pneumonia and save a life. And it can often feel like failure when you admit that you can't do that, and somebody's going to die. And you did what you could, and even if you do everything, a lot of times that feels like failure. Sometimes sometimes it's a blessing. I felt like with yesterday's patient, that was ultimately a blessing for her and her time. But God, we have patients today that didn't have to die if this thing didn't take them. They may have had a decade, or they had time, and to see so many of them lined up in a row heading in the same direction, which is down, ultimately, like to the grave and to the coffin, in a time when I can't just go in and sit down and talk to the family and shake their hands and listen to them tell stories and touch them on the shoulder and establish trust and rapport, and then deliver the news of where we're at now. These families are in the dark a lot. I think we've done a decent job communicating and making efforts, but it's just so hard because they can't come in. It's the right thing to do so they don't get infected, but it's so hard to. Hospitals, I think, done a good job doing FaceTime but people don't understand. Sometimes you can't believe it until you see it. And so, God, if there's 5 people that are dying, that's 5 families that I need to spend a lot of time with, and that's overwhelming. And then there's patients that are not dying, that have a better chance to make it, feeling divided and torn and guilty, like my time should be spent there. These are the guys that have a chance. They deserve my time and attention too, but it's like the immediate need of the dying in the moment. Like, literally, one patient's heart rate went down, her breathing, her oxygen level went down, her heart rate went down. She was in the process of actively dying, and we reversed it by putting her on BiPAP. And for all the doctors listening, so many people have said don't use BiPAP because it spreads the virus everywhere. It aerosolizes the coronavirus, and it makes it more of a risk for nurses, doctors, etc. I think in theory that's probably true and a good thing, but in practice, you can't. There's no way. There's too many sick people. There's too many that need this. There's not enough ICU beds and vents and all these things. And before doing this thing, I would have said, "Oh, BiPAP's a bad idea. You can't do that." But now, like, seeing just how many sick people there are, how we use it, how like intubating them brings its own set of problems and complications and infections, and there's a tube in the throat, and I'm not convinced that maybe that corona sprays a little less with a tube, but I don't think those patients necessarily do any better. I'm not convinced that it really serves them better. Anyway, so for this patient, she's actively dying, and at this point the family wanted everything done, so we put the BiPAP on her, and she got better. And by better, I mean her oxygen level went up and her heart rate went up, and she didn't die. But she was still in a coma. She was still unresponsive. She's still dying. We just kind of bought her a little more time. She's gotten all the right treatments, and her kidneys have failed, and she's got bad infections, and her her oxygen level is still terribly low. Now she's in a coma. Like, it's one thing if you're just treating coronavirus with respiratory support, but then when these other things start piling on top and the kidneys go down and you get some heart damage and people are confused and they can't eat anymore, and then it's just on, and it just, all of these things add up. It's not hay that broke the camel's back, it's a log. I mean, these are logs piling up on you. You can only stand and hold up so many before the next log, and it just sinks you. Down you go. So we start having conversations with families, and so many of them are, the pattern I'm seeing so far is like, call them, tell me what was going on. Well, everything was okay 2 months ago, and then at some point in the last couple months, their family member got sick, went into the hospital, and it's so hard because of this home quarantine, no visitors. It's just so abrupt for these families, where they were literally fine one day, and then bam, things changed so fast. And the next day they were in the hospital, and they couldn't talk to them. They didn't know what was going on. One particular patient got sick, got a fever, middle corona, gets a fever, called the doctor. They said, "How are you feeling?" "Well, feeling okay. Stay at home. Don't come in," right? That's the advice. If it's a young, healthy person, that's absolutely right. As long as you're not sick, don't come in. But these older, sick folks, don't come in. Makes you question that. And then the son never heard. He didn't hear from her for days. And it turns out she had gotten sick, collapsed. Eventually people had to break in, get her. Who knows how many days she was down. He was out of town. He hasn't seen her for weeks. We talked to him on the phone, and it's like, listen, we've done everything, and it doesn't look good. I wish there was more I could do, but I'm afraid she's dying. I want you to come in and see her, and talk to her, and touch her, and spend some time. It's the only time that people can visit is when folks are actively dying. I don't know. I think that needs to change. It just does. It just does. I think it needs to change. I know we don't want this shit getting spread around, but so many people are dying. They can't die alone, and they shouldn't without, people should have a chance to, or fine, let's figure out some way to do it where people stay safe and they don't spread this stuff. But that's so hard on patients and families. I'm rounding on patients, and I just worry about how isolated and alone, and try to spend some time talking to them and being there. And that's just one. There's just one story and one family, and another patient that died. Her son had died not even a week ago from corona, and then she got sick, and got sick really fast, went downhill in a couple of days, a day or two, and ultimately she died. And talking with her family, a family member had told me that she's like, I remember when she went out, we told her not to go out, and she went out, and then they both got it. Her and her son got it, and then he died, and then she got it later, and now she died. And then this is the thing that stuck with me the most, I don't think I'll ever forget this, was a family member said, I had talked to the family member, and we had a discussion about letting the patient go peacefully, because it looked like she was dying, and I felt that doing CPR on her in her last moments wasn't the right thing to do. And so we agreed to let her go peacefully, and I said, you need to come up and see her. Well, she didn't make it in time. The patient died. And they won't let her. Hospital policy is that only visitors can come if somebody's actively dying. I mean, it's so messed up, right? But that, at least it's that. I feel like that's even such a big exception. But if somebody dies, then they can't see them. Then it's back to the no visitors policy. And so her question for me was, well, can I get her body by the weekend, because we're having her son's funeral, and she'd like to bury him together. Jesus Christ. I've never seen anything like this. This is not the flu. This is not the flu. Holy shit, this is not the flu. The flu does not do this. This is not the flu. These people that are opening everything up and being foolish about this, holy shit, we're in for it in a bad, bad way. And the young and healthy and powerful aren't the ones that are going to suffer. It's the old and the sick and the immunocompromised. It's the weak, the powerful with money and youth want to live their life at the expense of folks like this. People will die, without a doubt. This shit is bad news. And I just feel for these families that are going through this right now, and the incredible amount of loss. But I'm just sitting here overwhelmed. Like, I feel like I feel like I've been kicked in the balls. That's true. It's like I'm stunned. And I need to take a couple minutes this evening and take a break and take care of myself, but you gotta come in tomorrow. You gotta come back tomorrow. Like, this is the thing. Like, you can't just sit here and have my pity party about how hard it is for me as the doctor. I mean, my family member didn't die. A lot of the weight is on our shoulders. We got a team. We have a team of doctors and residents, but you got to figure out how to get your big boy britches on and come back tomorrow to work and stay at it. Do what you can, especially for those that are still alive, and take care of folks that are dying, and do the right things. So what am I going to do differently tomorrow? Well, when we round, a question that I'm going to have with every single patient is, What's the code status? Where are we at with that? When was the last time we communicated with the family? What are the goals? Every single person, that's going to be like, where are we at with all that stuff? If we haven't talked to the family about where we're at, we need to have those conversations really every day. This is moving up on my priority items, is attending to this. It's like, where are we at with this? Like, have we given appropriate updates? Have we had the hard conversations that take time? I can't do 5 of those in a day. You just can't. You can't do them well. You can't just sit down. I mean, how are you sit down and tell somebody that their loved one they haven't seen in 2 months is dying? Like, people just don't believe it. Even when they come in and see it, they don't believe it. The common thing that we hear a lot, which this reminds me of my grandpa. The guy had a ton of strokes. He was always in and out of the hospital. And I'm sure they, told my grandma and us more than once, this looks bad, he might not make it. And every time we would say, no, he's a survivor. This guy's going to make it. Now I'm on the other side of that. I'm the one saying, hey, I don't think they're going to make it. And families tell me, no, she's been sick before. She's survived. And I'm like, I don't think she's survived coronavirus before. It's like, how do I say it? Like, she's not going to survive this. She's dying. And they have the right to want to continue to have everything done as their family member actively dies. There's a dilemma in here. I want to talk about it for a second. This is controversial. There was a documentary done on it. I don't remember the name of it. It was out of Highland, ICU in Highland, talking about end-of-life care. And I think people should have the ability to get treatment of things that work. And I feel strongly that when someone is dying, that doing things to them that aren't going to work is wrong. And to be very specific, in these cases, when people are dying of coronavirus and it's clear that they're actively dying in front of us, meaning their oxygen level is dropping from 80 and 90 to 40, where they're going to die in minutes, and their heart rate goes from 70, 80, 60 to 30, their heart slows down, and then their heart stops, and they're dead from a terminal disease, just like if they had brain cancer that had spread everywhere, or if they had pneumonia that had gone septic and got serious and caused shock and organ system failure, all that stuff. When people get to the end with coronavirus, that we should let them pass peacefully. We should not do CPR, where they get chest compressions and they get intubated and they get given epinephrine or they get shocks, and we run this thing we call a code blue. And there's a dilemma there, because as the doctor, ultimately I don't make that decision, the patient does. In an ideal world, the patient is clear about what their wishes are regarding the end of life. And if somebody wants, quote unquote, everything done, it often includes doing things that are brutal at the end of life, like chest compressions that break ribs, and it's just an awful way to go. And it includes things that don't change the outcome, that don't help you live longer. And the way it should be, and the way it is the way it should be, which is the patient makes that decision, not us. And I think that's true. But I would put an asterisk there. I would say the patient has the right to choose any and everything that is going to make a difference, that will actually help them live longer. And you can see how it gets into a sticky point where CPR and chest compressions and shocks and all these things. People want that done. It's like in the culture, even though so many times all it does is shock you as you're headed toward the light. And in this case with corona, in the cases of these patients, and you have to be very careful. You have to do it at the right time. You don't want to let people go too early. There's certainly times to dig in and fight, but there's also times to acknowledge that the lungs have failed, the kidneys are failing and getting worse. The patient was awake 2 days ago and now is in a coma, and when things are getting worse, when you get to a certain point, the possibility of survival is really zero. It's just not going to happen. And how do I know? Because I've done this for 15 years. And those of us in it have seen, here's a guy, for example, who is absolutely going to survive and go home. He's 40. He's diabetic, so he had a risk factor. Got sick. He did get intubated, got all the treatment, got better. He actually pulled his own tube out. We call that self-extubating. Usually dangerous, but it was okay. And now he just needs a little bit of oxygen, 2 liters on the little tube that goes under your nose. And he's going to be fine, right? Like, his oxygen's getting better, he's awake, he's eating, he's walking around, he's going in the right direction, he's going to recover. As opposed to, the 80-something-year-old patient with Alzheimer's came in confused, only needed a little bit of oxygen, couple liters, that went up to 5, 10. Now we've got a mask, so that's getting worse. Kidney function was maybe 60%, now it's getting worse, 40%, 30%, 20%. Was a little confused when they came in, now they're in a coma. All of a sudden, that's it. And we're treating everything. We're trying to reverse all that, get it going the other direction. Yet the disease persists. And so after people have been doing this for days, couple weeks, some of these patients are going on 3-4 weeks of this. You can look at this, you can see, and you can say not only, gosh, this doesn't look good, but in so many cases, patient is dying from this despite us doing everything we can. So that's the dilemma is, gosh, if a patient says they want everything done, should you do things that aren't going to make a difference, that are, as we call, medically futile? And people dig in around this. They have a lot of opinions. I don't think we should be doing CPR to people as they die, unless they are super, super clear that this is how they want to go. But I think what most people feel is that they want to fight, they want to survive, they want to do everything. It's just kind of been this natural survival instinct we have, and that what that means is doing chest compressions and shocks and all these things. Like, most of us share that instinct, and that there's a sense of quitting if we don't do that. But that's really not true. A lot of times it's just a family that's grieving, in the process of grieving, and is in denial about the fact that their family member is dying. It's complicated by culture. It's complicated by institutional distrust. It's complicated by me being a white guy taking care of black patients, and they don't trust me sometimes. They don't trust the system and the man, and a white guy being seen as withholding treatment like that can get very dicey. Again, from my perspective, I would never withhold any treatment that has a chance to really work and benefit from anybody. Color doesn't matter. White or black or Latino or Asian or anything. I think it's wrong for anybody when they die to be treated that way when they're dying. This isn't somebody who is healthy at 50 and who just drops out at the mall from a sudden cardiac arrest, who you put the pads on them and you could shock them and bring them back. That's not what I'm talking about at all, because that could help, right? That shock could literally save their life and bring them back. That is so far different than somebody who all their organs are failing and they've been in the hospital 3 weeks and they're dying and nothing's going to make a difference. I don't know if any of that makes any sense, but these issues are sometimes complicated and heavy and hard, and they're not quickie, easy, light things to wade through. And this is the reality of stuff that comes up. It's just more complicated by the fact that families aren't there. They don't see day to day the reality. It's hard to get it when you're not in the room talking and seeing the patient, appreciating day to day what's going on. That makes it more complicated. It makes it more, doing this stuff over the phone, like talking to them, in that way makes it more complicated. I don't know. I'm hungry. I'm gonna go eat something. Today was hard. Damn. Yesterday, I felt so good, and I was like, oh, I thought this was going to be really hard, and I was going to be whatever. And it's like, no, that's today. Today was exactly what I was worried that this thing was going to be. Overwhelming, a bit depressing, just a lot of things to sort out. Not, I want to care. I want to be emotional. I want to let it touch me. I don't want to be cold and frozen and unaffected. But, man, you can't let this demolish you, or you can't keep doing it. That's hard. That balance is not easy. So I'm going to take a little time tonight, take a little break, get a little recovery, bounce back tomorrow. My hat goes off to all of these New York and places all over this country and the world who have been in this trench much longer than I have, who have dealt with this in the middle of their big surges and done their best and dealt with all this stuff. I have a lot of respect for those guys. This is day 3 for me. What a wimp. What a wimp. Day 3, kicked in the balls, and I'm whining about it to you on this podcast. There's a lot of folks that have been digging into this thing for a long time. I have a lot of respect for them, especially nurses, especially the nurses. Doctors will go around into rooms, talk to patients for a little bit, but it's the nurses that are in and out of those rooms all day long, giving meds and really risking themselves on the front line. So I really have to tip my hat more to them. I think I've come to appreciate that more for nursing sacrifice. I think I whined a little bit before. I was like, nurses are getting paid a ton of money for this, and I'm volunteering, and now I'm like, nurses should be getting paid a lot of money for this. Seeing how they really are in and out of those rooms with those potential exposures. And I think they're all doing the PP thing to protect themselves, but you get what I'm saying. Tip my hat to nursing and respiratory and all those folks. So be back tomorrow. Ain't giving up. Talk to you later.